Good morning. Thanks for joining. We'll go ahead and get started in just another moment. Alice, I love your cat. I also have an orange cat.
Thank you. Yeah, he is gonna be, he's 21 years old, and so he's not to be denied. If he wants to sit on my lap, he gets to sit on my lap, and he does spend a lot of time on Zoom, I will say.
That's a pretty old cat.
Yeah.
Well, that's great. Sometimes it's easy if we're typing away to sort of push them away. So it's nice that you say yes. So very cool. So Dr. Bullen will probably especially want to wait for Sherita to join, right?
Let me go back to the main room and just see. I assumed everybody was staying, but you could probably go ahead and get started, because again, this is really meant to be a discussion with everyone and really just have some discussion. So it really doesn't matter if she's here, although we love her and want her to be here.
Sure. Okay.
Yeah.
Well,
so let me jump
Absolutely.
back and I'll come back in just to see if there's any issues there. But yeah, if you guys want to go ahead and get started, I think that would be great.
All right, sure. If we feel like it's time to get started, let's go ahead and do so. So together, and maybe bring to mind what sort of inspired you to show up to this Un-meeting this morning. And particularly, what made you choose this discussion, this breakout room here?
Am I in the right? I just was transported somewhere.
You're transported in just the right place.
Okay, great.
And we're just taking a few breaths if you would like to join us.
Oh yeah,
so
I'd like to breathe.
Yay! And so maybe if you want to close your eyes. So we were just bringing to mind what inspired us to show up this morning, and what brought us to this room in particular. So maybe bring that to mind. And perhaps bringing an intention for our time together today. So knowing that there's no direction, there's no right or wrong answer here for this time, just sort of trusting that we're in the right breakout room and with the right people to sort of have this conversation. Maybe knowing how much space you do or don't typically take up in a space like this, and see how that might inform you. All right, and if your eyes are closed, go ahead and open them. And welcome back. So it's great to be with you all. And I'm really just here to support and sort of maybe steer us, but really just really think it's great that we're all here. And Sherita, it was really great to hear that. You can tell how much you love it and you're passionate and love the work that you do. And so I saw that through that presentation, and I really loved that. And so maybe just to kick us off, a general question that may lead us somewhere totally different, but so just keeping in mind that the Community Development Corporation, CDCs like Burton Belcar, providing various services and resources for people in our community who maybe cannot or will not access traditional healthcare institutions for various reasons. What comes to mind as some of the greatest challenges that CDCs typically face? And so this can start to get us going here.
Yeah, so we find a lot that our residents have trust issues with health institutions, institutions, period. And so what we do is we try to listen to our residents and have those conversations. And we make sure that when we receive feedback, we respond in our initiatives and the development projects that we do. So for example, with our Healthy Food Access Initiative, when we received the funding, we immediately did a series of community forums. And we was like, we have this opportunity. What would you like to see? What would you like us to do? And a part of that was a cafe. And so if someone was like, we want lobster on the menu, We want this and this and that. But we heard from them and we made sure that those items, well, we couldn't put lobster, but we could put lobster bisque. They had soup.
There you go.
But we made sure that the foods that they wanted on the menu were on the menu. And for the classes that we have, we made sure that it addressed the health concerns that they had. And even with the instructors, to make sure that they are approachable and have that a good feeling so people can feel like they're at home when they're in our space. And so we do that through all the different initiatives that we do. We make sure that residents are heard, and what we hear from them, we make sure that they can see those improvements in their neighborhood. And so as we build that trust with them, we bring in partner institutions as well. So it's almost like the trust they extend to us, they extend to those partners because we're a part of that process, if that makes any sense.
Wow. Well, thank you so much for sharing that, and great to hear that the minute you receive funding, your sort of inclination is, let's hear from the community on what we can do to support them and be trustworthy. Building trust might be an outcome, but how might you be trustworthy? And so how cool is that? So what do others think of that?
This is Aaron Fouts. I'm part of the CRU at Cleveland Clinic, the clinical research unit. And I just wanted to say, Sherita, was a great presentation. I really liked some of the strategies, whether you knew you were giving strategies out or not, of just how to really connect with these communities. What we're trying to do is not too different from you in terms of building those connections, being a liaison, and really trying to affect health disparities, improve them through our small sphere of influence, which is clinical research at Cleveland Clinic. So I loved some of the feedback you gave. It's listen to the residents. These are things we've started to go out to the communities and engage and try to build trust, try to listen. Exactly. And I like that you said that you should respond, right? That's very important. It's one thing to take feedback, it's another to act on it, and I commend you for acting on it. That's some of the projects that you've done are inspiring.
Thank you. And we have a partnership with Cleveland Clinic through the Langston Hughes building on Carnegie. And so I was excited that they reintroduced like their programming about a month or so ago. And so we are trying to find ways that we can promote the activities there with our residents, ensure that, we take advantage of that beautiful facility. So.
Awesome. Yeah. Well, then maybe you'll see a part of our team there. That is actually where we started our initiatives as well. So I don't know if you know Rosalia Stadler. So she's a program manager too that works there. But yeah, we were excited to hear that they re-kicked it off to the grand reopening. It was this past year, I think in 2022. I can't remember. But yeah, so I would say maybe we'll come across our paths will cross at Langston Hughes then at some new event. But I'm excited to hear that you already have that partnership developed with Cleveland Clinic, and hopefully we can expand that, right? So
thank you.
Ms. Mullins, I want to thank you too. And kind of following off or echoing Aaron's comments, I'm the director of research operations for the Neurological Institute at University Hospitals. And I want to give you some background. Phil, if I can, our coordinators on their own over the last 2 or 3 years have been doing a community outreach to try to improve the disparities of research for minority sections of Cleveland, both in the Hispanic and in the urban area of Cleveland. And we have done some great work. Our coordinators on their own created let's say, for instance, we just had a Black History Month that was aired, and we had the speakers of Leon Bibb as our host and Mayor Bibb as part of our forum. And the idea here is just to talk about not only for the community members, but to get involved with research that affects the, let's say in this situation, the African American community in the areas of hypertension, Alzheimer's, stroke. All three of those areas are have a high propensity for the African American community, and their awareness to be able to participate because as a self-serving part of this, the research community needs a broad spectrum of enrollment to see if medications work or if FDA approvals will really benefit all involved. And so having that opportunity to reach the community is very, very important for us. And I see that happening now with the NIH. The NIH has put a huge focus on outreach for marginalized communities that are not participating in research. And you had mentioned too that there's this reluctance to want to participate in research on many of these communities, and we see that. And so I just wanted to see, first of all, we're creating the wheel here, but there's a lot of places like yours that have already created this as well. And Aaron, working in tandem so that we're not all just kind of spinning our own wheels or creating things all in unison, but we're all in different directions. Is there any way to collaborate and to connect in a unified manner that will push this forward? So that's one of my questions. And if not, do you have suggestions for me so that I would be able to better direct my staff in the best ways to reach the community? And I will add, we have gone out and talked to a couple of the pastors of the Cleveland area as well, and tried to get into the church communities there as well. So we are working a lot in this area, and it's kind of a ragtag bunch. This is not something that we have people that are employed specifically to do. We're doing this on our own and on our own free time. So Ms. Mullins, if you have any suggestions for us, I would love to hear them. And also the opportunity, Aaron, anybody else on the call, if there's a way we can collaborate, that would be, I'm all ears.
I had a few responses. First is the way to each neighborhood in the city of Cleveland has a representation from a CDC. So for us, it's Kinsman Central and Buckeye. So a lot of times agencies do approach us to engage with residents. It can happen in a different form. So like we have a lot of community meetings. So you can do a presentation at a community meeting, partner with our social media and our marketing platforms. Like you can place like an ad in our newsletter or, something like that to get access to our residents. And also, I would say the pandemic has changed how we can engage with our residents. So for 2 years, everything went virtual, and a lot of our residents did not go virtual. We learned of the digital divide and lack of access and things like that. And so we're just now able to reconnect to them in person. So we learned that that's the best way to interact with our residents. And so we want them to know if they come to an event, we want them to know that we value their time and effort. So we make sure that there is refreshments and food there. A lot of times we give an incentive like a gift card. It's like compensation. We would get paid for our time when we're in the community. We want them to feel the same. So we make sure that they have some type of takeaway when they come to an event. And a lot of times that fosters that relationship as well. So they continue to come to more and more events. And so that's just our strategy to engage with residents, and it has worked. With our community health needs assessment, our strategy was we went door knocking. We hired residents, trained residents to administer the survey, and they door knocked. It had like a tablet, a digital survey, and our model was a $10 gift card for 10 minutes of your time. And all residents said yes. It was no issue. They took the time, answered the questions, and it went into a digital database. And so within 8 weeks, we were able to get over 1,400 responses that way. So that was our way of getting back into the neighborhood post-COVID. Well, we're still in COVID, but after, we were able to join back in the community. So those were just some strategies of community engagement. And then also what we're planning on doing with our in terms of future collaborations, we are crosswalking our data from our assessment with other entities like the county and the hospitals. You know, they're doing community health needs assessments as well. So we're having those conversations of alignment of the results and what type of implementation is necessary for our neighborhoods and what makes sense to partner. And so that's how, you know, we're in the local level, the deep down in the neighborhoods, how the hospitals and the county can make that more of an impact. So we're in having those conversations now. So I look forward to that. What was your,
Well, let me
forgot
comment
your
really
second
quick.
question.
Well, let me comment really quick. The grassroots is just it warms my heart to hear that. That's fantastic. And I actually had my wheels turning in my head really quick because I'm thinking one of the things is not only to make the community aware of the research opportunities and the healthcare opportunities that are within our Cleveland area, but also I would love to study whether, you know, you need some kind of metric to reach people even further. So I would love to find out from the communities that we reach, you know, what's their change of attitude? Is there a change of attitude? Does it matter? You know, where are we failing if we're not getting the message out in that area? So that's a whole new area that I, you know, kind of considered, and you're knocking on the doors. We might be able to do something like that, or create funding that's available to do that. I know that the National Institute of Health has said that they have a grant set up that we could request, and then there are 4 forged projects like this. So very simple to do, and we could do that within a short period of time. But anyways, that was the first one. And the other one was just, you know, talking about partnerships. You know, if we're out there meeting church groups right now, and if we're out there doing a webinar on once a year, let's say for specific topics, you know, is there a way for this group, you know, where Aaron was talking about, you know, wanting to take this a little bit further, or myself, could we, the Cleveland Clinic and University Hospitals, lock arms with your community group and offer up something on an opportunity to work with you in collaboration? We do that in the Glenville area right now, but to expand our reach would be so much more effective. And I don't know, I don't want to monopolize the time. I know there's a lot of people on this call and they probably have a lot of other comments that they want to add in, but those were my thoughts.
Yeah, I wanted to add a brief comment to that.
I just wanted to say, David, that I mean, I think the best way is through the CTSC, honestly. I mean, we're trying to develop a process for taking on like multi-center studies and collaborations. I know that's more formal in terms of, but this is community outreach and partnering. I know that that's still kind of in development, and we're trying to figure out exactly how we want to approach this. This is relatively new, at least to my group, in that we are trying to create this, what we're calling community engaged research. I think we've done a good job of defining what we think that means over the past 6 months. We have 3 core strategies. We do it through community service, community partnerships, and then we have patient recruitment specialists that are paid to ensure that we are increasing diversity and inclusion in clinical trials. And so through those 3 arms, that's how we're tackling this. We've started to kind of outreach. Really, we started at leveraging existing relationships and partnerships. At first, when we started, we thought, let's go out to the community. What events do we need to go to? How do we connect with the community? But then we kind of backed up and said, wait a second, this exists. There are community partnerships and health centers that already have these established connections. Let's first identify them, try to pull everybody together. So to answer your question, we are pulling everything together now at Cleveland Clinic, and hopefully that translates to, okay, we got those ducks in a row. Let's outreach. Let's talk to UH. Let's talk with Case. Let's see how we can actually tackle this problem together. So it's still in development. Go ahead.
Can I add something? So our communities are over surveyed. They're tired of being surveyed.
Okay.
And what helps, I would just want to reiterate, you have to you just don't want to come in and leave. They want to know that you're here for, that you care and that you're going to do something for their neighborhood, address their needs. And so it's important to communicate that, your intent behind the research. Once you do that, you will start to get some responses. And then in our listening sessions recently, we heard that community health workers are trusted in our neighborhoods. And so community health workers are the ones that go into their homes and tell them, give them checkups and make sure they're connected to the resources that they need. And that I thought that was useful to hear, that they may not approach a primary care physician. They may not talk to their doctor, but they are saying that they will speak to a community health worker. And so identifying trusted people in the neighborhood, to me, it's a strategy as well to get that information.
Great. And I do see Noreen is off mute, and I know Dr. Bullen, you were going to say something.
I just wanted to, I'll say one sentence, just that, I'm with the new CTSC, we'll have a community and stakeholder module, which I'm co-leading with Darcy. And Aaron, a lot of what you just described is something we want to make sure we do. And I really wanted to, that will be one of the things, is having that community engagement network. And so I'm glad actually I'm on this thing with you, so I know who else to reach out to at both UH and Cleveland Clinic. That's going to be starting just again with this idea that Sherita just mentioned, that first of all, everybody's coming at them with similar requests. One, community members are hearing similar requests, but also, there are a core of people who've done a lot of community-based and community engaged and community partnered research with lots of experience around that issue of, it's not in and out. You really do need to be with that community over time. So I heard that loud and clear. I'm writing that down in my notes, but I think that's something is absolutely true, and we want to make sure to do that. And then I'm going to let other people speak, but I think there is some work that needs to be done, so we're not like every different organization going, with the same request to community partners. And I'll let Tyler moderate.
Okay. All right. So I know Noreen, I did see Margaret came off for a brief moment, and then I think it was Tashiana and Alice. So maybe Noreen, if you may have a comment.
Yeah, hi. First of all, Sherita, thank you for the great work you're doing with the CTC. It's just amazing work, and I really applaud what you're doing in life. I wanted to just say quickly, my name is Noreen Roman, and I am Administrative Director of the Clinical Research Unit, the DOMS Clinical Research Unit at University Hospitals. So, David, I know that we've not met in person, but hello. So, and to all, I do think, and I want to kind of piggyback on Aaron's comments, that the CTSC is a great resource. And I think, Sherita, there's lots of ways for the CTSC to work with the CDC. And our new community engagement, as Sherry had discussed, as we kind of enter into a new grant starting July. So I look forward to all the different ways that we can engage with the community, support what you're doing, and create opportunities for the persons in the neighborhoods, local neighborhoods, to increase the health of the population here. So thank you.
That's wonderful. Margaret, would you like to?
I'm good listening. I'll if there's time, I'll loop back in.
All righty. And is it Tashiana?
Yes, thank you. I really love the conversation, and there's an emphasis around trust that I think is so key to all of this work. So I work with the UH Rainbow Center for Child Health and Policy. I'm the project coordinator over there. And one of the things that's interesting just from hearing the points here is that we don't really do clinical research. A lot of our research revolves around qualitative, in addition to the quantitative research, of course, but I think there's an emphasis that I want to put on the importance of qualitative and really getting that story, that perspective from the residents. And then to Sherita's point, I think in regards to building that trust and also the visibility of us as researchers being in the communities, I think it's easy to put it on an agency. I understand recognizing and working with in tandem with those partners, but there's also visibility that needs to be there with us as researchers, showing why we're there, really making sure that the residents know that their perspective is important. And so one of the projects that we do is we call it the Neighborhood Story Project. This will be our 3rd summer doing it this year. And we go around and we just have conversations with residents about the changes that they're seeing in their neighborhoods. And I think, David, you might have alluded to this earlier, just how do they feel about the changes that they're seeing? And so it's one of those things, we have repeat interviewees who are happy to do it with us, going on 3 summers. And so just really hearing those stories and then bringing it back. And then what do we do with those? And so I guess a question that I have, and this is really for anyone, is when it comes to that dissemination piece, any techniques or suggestions that you have in getting, now that you have the data, how do we get that out to the residents in a way that they would like to see it?
I can take a quick stab at that. I just know that at our community meetings that we've had at the churches, local churches, and Sherita, you are right. I mean, we've been in these churches now for over 2 years. So, our coordinators have put in a lot of time, but I think making it a meaningful discussion of what really affects the community, such as hypertension, diabetes, stroke, or Alzheimer's, that these are areas that affect the community, and that the community themselves seem to be somewhat unaware of the numbers that, that at risk that they are, and the opportunities. A lot of them may not have access to some of the clinics, but through clinical research, we can make that access available to them and give them high quality care. So there's kind of a merger here of awareness and education, and then another one is for opportunity. And you want to try to marry those two together. And you're right, you don't want to bombard, and you do need to create that trust. And, and I think to everyone, I've learned a lot from this call right now. I didn't know that, Ms. Mullins, that you existed, and Aaron, the CMT. This is the first time this group right here was aware to me just a few months ago. So, I'm kind of fumbling my way through this, in this darkness, and there's like these small glimmers of light that I find, and I'm trying to glom onto them as quick as I can so that I'm not recreating a new wheel here, but just, springboarding off of what the experts have already done and see what we can do to offer to help in that assistance as well.
Yes.
And
Oh, please.
I'm sorry.
Oh, no, I'm sorry. Please go ahead.
Okay. I'm just now getting my stuff situated. So to piggyback and add to that, by the way, my name is Delisa Delcan. I am not a researcher. I am a registered nurse working for the Department of Veterans Affairs, but I am actually here representing an advocacy group, National Coalition of 100 Black Women, who advocates on the areas of health, economic empowerment, educational, and finds a way to merge all these things through public policy changes as well. So very timely discussion. And to kind of piggyback off of some of what David was just mentioning, I think it really, just from the work that we've been doing in the community and trying to get more engaged, there's definitely that element of building trust with whom you're trying to serve, really trying to get to know them, and finding a way to, I guess, translate that data into something that is meaningful and that's not going to be overwhelming, and maybe having like some small calls of action, I guess, associated with it. So if we know that there's something with hypertension, and we know we can't fix everything with hypertension, maybe small steps in terms of like, choosing salt substitutes or things like that, or, whatever your intervention is going to be. I think making it bite-sized, for lack of a better word, and palatable, and it will help engage your community. But again, finding ways to kind of bring all of that back full circle so that you can continue to help them through like short and long-term goals, I guess. And I felt like that was kind of a long way of putting all that together, but really thinking at it from like a systems point of view, and how can you help within the short term and the long term, like at the same time.
Yeah. definitely like this cross-cutting theme of not wanting to duplicate efforts and making this meaningful and actionable, not only for the organization, but also for the community members. And so how can that be meaningful to them? Okay, well, really quick, I know we have 2 minutes. So one thing that maybe we should decide on is who might want to, Sherita, do you have a preference on who wants to sort of report out when we come back with the larger group, or?
No preference. You can do it if you like.
All right, well, if you say so. No. I could start, and then if you would want to maybe wrap us up, if there are other thoughts that I might have missed, what do you think about that?
I have faith that you got it.
We'll see. All right, I don't know how much faith to put in. Are there, so we have just probably about a minute left before I think we may be kicked out. Is there any last something that someone's really feeling like they really may want to add to this conversation?
Yeah.
Yes.
Oh, go ahead.
Can I? Oh, I'm
Nope,
sorry.
you first.
Sorry.
No.
Okay.
Go ahead.
I just kind of quickly introduce myself and my work. I've been a faculty at CASE for a long time. And I think the AAPI community has been the invisible and ignored populations. And even they are the fast growing population in Ohio, in the county of Cuyahoga, as well as the city of Cleveland. So in the past year, we have recruited 7 medical students actually focus on AAPI community, and we did the environmental scan. And we recently get funded, and it will be the first time in Cuyahoga County and city of Cleveland to look at the AAPI communities. So we're going to engage 8 different organizations, AAPI organizations, and a large group, and as well as a national group, and to look at the needs assessment and come up with a strategy. So this is probably a good time. This is a brand new, we just started, and